Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, Chief Wellness Officer of GW Medicine, Executive Director of the Office of Integrative Medicine and Health, and an Associate Professor here at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today on the pod, we talk about whole person leadership, cultivating capacity for transformational health for all with Dr. Scarlet Kali Soriano. She is an international recognized expert on integrative medicine, health equity, and community-based health.
Dr. Soriano is the Executive Director of the Leadership Program in Health and Wellbeing for the Duke University Health System, where she leads a multidisciplinary team in innovation aimed at addressing gaps in our healthcare delivery structures through equity-based health and well-being interventions.
Dr. Soriano is a member of the Board of Directors of the Academy of Integrative Health and Medicine, also known as AIHM, and she is a founding member of its Black, Indigenous, and People of Color Committee.
Welcome to GW Integrative Medicine, Scarlet Kali.
Thank you for having me. What an honor.
Oh, it is absolutely our honor, and I'm glad we could make this happen. So I guess let's just dive right on in. We mentioned it in the intro, whole person leadership. I think everyone here thinks it's a powerful concept, but for our listeners, what does it mean to you, and how does it show up in your work at Duke and beyond?
Well, thank you, Lee. I think that's a really important question, and it's an important question at any time. And I think especially now, when I think about whole person leadership, I think about first leadership. So maybe first let me start there. When I think of leadership, I think of a person's privilege to call forward their highest attributes in such a manner that allows them to find the stillness, the balance, the clarity within, in order to create a container, a conceptual as well as structural, right, and procedural, but a multi-layered container within which others can find anchor, and within which others can also find that space and opportunity to bring forward that which is part of their own purpose and mission in their professional or vocational lives, or in whatever context this leadership might be. So I just wanted to start there, because I think of leadership as this unbelievable inner set of skills that can be learned, that can be cultivated. We all have this capacity within us, and that require that we come into a place of harmony within ourselves in order to truly be able to support the movement forward of a vision, of a product, of an idea, whatever it might be that we're doing. And so then we take that and we bring whole person. And so it's a little bit redundant in some ways based on that definition of leadership, but it is a way of underscoring the fact that, on the one hand, whole person leadership requires that the whole being be invested in this gift of leading. And leading is always serving, right? Leading and serving are the same thing. And leading and collaborating are the same thing. And we all take turns in sort of shifting perspectives and shifting tasks and skill sets. So I just want to say that one isn't just a leader or just a collaborator. It's always one can have the role of navigating more often, but all of us really are playing these roles throughout our lives. But then with whole person, you have this need for the leader to draw from all of themselves, mind, body, spirit, community, the whole of their inner being in order to be able to serve in this capacity. And in the context of health and well-being and healthcare in general, you have this there is both a growing awareness, a growing commitment, and a great need for the whole person to enter fully into the center of the equation of what health and healing means. And for us, in whatever aspect of health and well-being where we are, to attend to all of the person who is with us in the communities we serve. So that's sort of the unpacking of that.
One of the things I think we often forget about with leadership is the importance of followership. And you kind of alluded to that in your comments. I wonder if you could say a little bit more about the importance of followership.
Yeah, absolutely. I think that we are all always called to step forward and bring our whole selves from the most balanced and clear stance we are able to create for ourselves at any given moment to attend to what is needed. And so in a given moment, it might be that when I come into a meeting or into a place in the community or a conversation or a project, what maybe if I am attentive, if I am present, if I am bringing my whole self, then I can discern which aspect of the continuum between following and leading is mine to be expressed in this moment. And in doing that, whichever role it is, with an open heart, with the fullness of my mind, with the fullness of with an intention for certainly my highest good, in always the highest good of the whole and of that which we're co-creating, then not only will I find my place, but I will find my place that is sort of the best service I can provide, but I will do so in a manner that is enjoyable to me. And then it might be that somebody else leads and that I listen and follow, or that I lead, or that we take turns. It's really a dynamic. It is a continual conversation that we all have. And I think that the critical piece is understanding that when we come into a situation with as much coherence within ourselves as possible, we will know what is needed from us at any given moment. And then it just more naturally emerges from us, and we kind of bring our peace.
In your leadership role, how do you see integrative health principles advancing equity? I mean, not just in care delivery, but also in how we lead and structure health systems.
I think integrative medicine has just this incredible. I'm biased, of course, as a board certified in integrative medicine. So I just want to put my bias very clearly out in that I have had the opportunity to experience firsthand how that perspective, that lens through which to see health and healing in healthcare, um, can influence profoundly how one practices. But I think from that perspective, with that understanding, that integrative medicine has a unique opportunity to contribute to how we grow leaders, how we structure healthcare, how we deliver, of course, healthcare, and how we conceptualize health and integrative health. And I will pause here and also just say that there is a larger sort of sphere, especially outside of the United States, in which traditional complementary and integrative medicine and health is considered sort of there are parts within practices that have many of which have great richness and thousands of years of human experience, and a lot of and for some of them a growing body of data along the lines of what we've established, within a more Western framework and allopathic framework as as data and research. But within the bounds and outside of the bounds of our sort of more the more dominant paradigms, integrative medicine and this larger body of enormous wisdom that exists around health and well-being in this planet have great things to teach us about how to structure healthcare. For example, when we think about integrative health and integrative medicine in traditional complementary and integrative health systems in general, there's a foundational concept of balance and harmony that tends to be found across disciplines. And so you will see that this idea that the inner and the outer are in relationship, and that the inner within itself, mind, body, and spirit, mind, body, spirit, and community are interrelated, in that we have to attend all of them in order to establish true health and true well-being. So these kinds of concepts, which are foundational to integrative health and to these other systems, have a great deal of value for how we think about healthcare transformation. And what does a clinic look like? Does it include a garden? Does it include a teaching kitchen? Right? Does it include nature? Does it, all of which we know have evidence behind them for therapeutic potential, for the capacity to generate the kinds of feelings, subjective experiences, as well as in some cases objective data that tell us that the person is aligning with health and well-being, aligning with balance. So maybe a walk in nature after a clinic visit as part of the process, or procedures within our hospitals that create opportunities for nature therapy, for music, for art, for a daily experience of healthy community. How could these kinds of things that are so natural and foundational to integrative health enter into how we think about what we experience as healthcare concepts and also as healthcare structures? I think there's a tremendous amount that integrative medicine can contribute.
What you're saying reminds me of the physician who started the whole entire movement to write prescriptions for nature walking.
Yes, absolutely. And there are many ways in which, even if we cannot, and there might be circumstances in which it's not necessary or called for a particular clinical setting to do it all. Although I will pause myself here and say that I have had the privilege, for example, of being in institutions that house a teaching kitchen, and to see the patients learn about healthy food that's easy to purchase, that is cost effective, easy to cook, and that will support improvement in diabetes or renal disease, or to see that kind of transformative experience within a healthcare system is just magnificent. And where I've seen gardens, but where that's not possible, that's where our connection with community organizations, in a creation of true corridors that are respectful across disciplines and across domains, can be an amazing way, and perhaps a much more sustainable way, for people to be able to experience whole health.
I can tell Lee's smiling. Even though I can't see her, I know she's
Absolutely.
smiling with what you just said.
Yeah.
Absolutely. It's wonderful. And we would love to learn more about how you do it. So, in terms of creating leaders who can truly transform healthcare with this equity lens, what are the biggest challenges or gaps? And then how do you work to address them
Yeah.
at Duke?
Well, thank you. I think we have great, these gaps that are sort of coming through our conversation. So we'll start with the gaps, and I'll tell you about our work. And we are deeply involved in leadership development in the Duke leadership program in whole health and well-being, which I have the privilege of directing with a group, a very dedicated team of people who are hand in hand with me, really visionaries, bringing uh, the tools together to cultivate the kinds of leaders that we need to transform healthcare in the United States, but also international. We have a lot of people from other parts of the world who come and train with us. So I'll tell you more about our program in a second. But starting with the gaps, I think that there are a couple of ways in which there are gaps in cultivating this kind of leadership. One is in that it's not really formally, and it's not formally sort of woven into the fabric of a lot of our training, the training in healthcare from which many people who end up in leadership positions arise. They train in sort of knowledge about whether it's, the body and sort of physiology and pathophysiology or bedside skills, depending on or whatever it might be. So that we train in specific bodies of knowledge around what to do for care, but we don't often train routinely in how we bring ourselves to that place of inner balance and clarity that is required for leadership. And we don't train in the kinds of skills that allow us to develop strategy, that allow us to have return on investment, that allow us to think about what will move something forward within specific economic kind of landscapes and specific institutional financial constraints. We don't learn necessarily about what it takes to create avenues for people um, to engage in the to engage with the vision or that which is being moved forward. And so those are gaps that are across the nation. Um, what we do at the Duke Leadership Program in Whole Health and Wellbeing is to really take leaders across domains, across disciplines. We have clinicians, we have educators, we have policymakers, we have folks that are benefits leaders, we have a number of entrepreneurs who are creating an idea and bringing it forward. So really across the whole landscape, we have folks that are starting something completely new in another country. Come in and learn. There's a core, and it's all online, both synchronous and asynchronous. We have a 9-month core program that gives leaders the tools that they need through a sequence of modules that are created with working professionals in mind, and that really take them everything from entrepreneurship, from faculty at the Duke Fuqua School of Business to strategy development to thinking about modules, say with Patricia Herman teaching about economics in healthcare, or somebody to have these people who are really shaping a lot of how we think about healthcare, teaching these modules and providing leaders with the skills that they need. And then we have synchronous panels and round tables and fireside chats with these very same people that and core faculty, which include Ben Kligler, who, as you know, is the director of the Office for Patient Care and Cultural Transformation at the Veterans Administration, and Melinda Ring, executive director of the Osher Center at Northwestern, and other faculty that are anchoring their learning through both these live experiences as well as opportunities for moderated discussions around topics. And so there we really have supported many leaders who are now shaping institutions in the country to come forward and to gain the skills that they need. And then we have two tracks that are advanced tracks. We have an advanced entrepreneurial track, and we have an advanced leader track for those folks that are really interested in really bringing an idea from concept to business model and really working directly with professors at Fuqua. Then they can sign up for the entrepreneurial track along with the core. So they occur, the advanced track starts 3 months into the core. A person can just take the core or they can choose to take both. And the advanced track will give them one-on-one dedicated mentorship around whatever idea, whatever they want to bring into the world. And for those that are less interested in own sort of more business focus, but more conceptual or policy or more visionary at a broader scale, then they can take the advanced leader track with Ben or Melinda or myself, and they will get one-on-one mentorship around a concept that they want to bring forward into the world. So that is sort of the nuts and bolts. Our next cohort, I'll just put a plug in here that our next cohort starts in September, and applications are rolling in. We do have some limited financial aid for those that can benefit. And so I would encourage anybody who's really ready to take that next step in their leadership in whole person health to come. And we actually have Q&As scheduled through June, and I'm happy to also meet with anybody who's interested. They can reach me at Scarlet, SCARLET Soriano, SORIANO at duke.edu, or our amazing, incredible, extraordinary program manager, who's probably the best person. That's Damian Galina, who's been there from the program's inception, and his email is DAMIAN, Damian, dot Galina, GALLINA at duke.edu. Either one of us are available to answer any questions for folks. And we've had multiple people from the same institution come and participate as a way of really making institutional change.
And that's what we need. I mean, there are so many soldiers and generals like the both of you, but if we can't get at the system, it's slow going.
Yeah, what I have seen. So one thing that I would just say is that well before I had any inkling that I would be back at Duke as director of this program, I went through this program, and it was life changing for me. So you are right in that what can happen in that kind of an immersion into a community that is thinking with you, that is encouraging your ideas, that is helping you think outside the box about whole person health, and that is really nurturing those powerful, potent seeds that are needed in the world. Is that what can happen is that those seeds really actually germinate, as in my case. I remember stepping coming to Duke and being there with Ben and Melinda, and I had the privilege of hearing actually a dialogue with Christy Mack, who's a true visionary. And for anybody who is interested in thinking about really forward-thinking innovation in healthcare, please check out takecare.org. That's the word take care, the words take care all together, TAKE takecare.org. That project is a project that stands to make profound impact on health and well-being and a whole person health perspective. And we are in partnership. Duke is in partnership with Take Care around a Durham pilot. But I had the privilege of being nurtured by these leaders and seeing how vision can become structure, can become change. And it shifted me at some deep level. And I found myself back doing this kind of work. So for anybody who's really listening and who's interested in taking a big leap, it really does happen. And I've seen it with other colleagues as well.
We're in challenging times right now. There's transformation in healthcare, there's burnout, systemic inequities, AI disruption, which sometimes seems good and sometimes seems bad. But how can whole person leadership help us navigate these shifts with integrity and even more so resilience?
These are the most, I think, in some ways, the times when um, all of us are called to that definition of leadership that I started with. I think at times where there are potentials for um, discord and disharmony, leadership is our ability to find and cultivate. It requires work, it requires nurturing, it requires the work of loving ourselves. And when I say love, because love can be a very charged word, I say unconditional regard. That's what I mean. I think of no more valuable thing at all than the capacity to generate unconditional regard for ourselves first. When there is divergence, when there is disharmony, when there is imbalance, when there is not knowing or lack of clarity. And in that cultivation, in that stepping forward, when you have to mount a lot of energy to open your heart and to find that uh, that that intention for good within yourself, for yourself, in that place is um, the pearl of leadership. In that place is the richness, the treasure that can then allow you to be that stillness when the world outside, which oftentimes reflects what's happening internally for all of us as humans, when that world needs calmness and stillness and minds and hearts that are coherent and that are able to see past difference to common humanity, then you can stand up because you've done it in yourself and you can hold that space honestly for others. I think that's what's being asked of us right now, that we are able to see past conflicting belief systems, conflicting ideas, to the unity of the life behind the ideas, in the primacy of our connectedness as a human family and as a living planet. So, really, that's where I go as I think about the question that is the most important question in some ways.
Well, that's very helpful. Thank you so much for that. As one final pearl for our listeners, many of whom are health professionals, educators, or future leaders, what's one practice or mindset shift you would recommend for showing up as a more whole person leader today? What can they do as soon as they finish listening to this podcast?
So, I'll give you the kind of very quickly the big answer, and just within that, a couple of thoughts. I would say the first thing to do is to focus on creating balance within the self. That is like, if you finish listening to this and you say, okay, I want to show up in this way in the world, I would say, what is it that I need to care for myself? And each person will need something different. It might be that I need more nature in my life. And so where in my busy week am I going to find a patch of green that I can anchor myself so that I can create a moment of harmony that regenerates my capacity to be present and to attend and to create clarity within myself and keep my heart and mind connected. It might be that I need to really literally pack some whole food. Um, it might be that I need to come and join a cohort of the Duke. I'm laughing here because I'm come and
It could be.
join a cohort of the Duke Leadership Program in Whole Health and Wellbeing. Or it might be that I find a mentor within my institution. But I think each person needs to take a moment and find within themselves what is it that they need to first and foremost care for themselves and find harmony. And one thing I will say actually with my work with Take Care that I have learned is that small steps add up to a great amount of change. So what may just be like, I will let somebody else fold the laundry and go to bed earlier so I can show up brighter. That might actually be an enormous step for your team, for your people. Or I will make sure that I put a bag of apples in the fridge at, at, at work so I have something fresh that I can eat. Sometimes it's these very simple, practical things that can really help us. And then the second thing I would just say is stop and put yourself in the other person's shoes as much as we can, to whatever extent we can. If we can look past what may be very, 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 very different ways of seeing the world, if we can just take that and park it for one moment and see to the light in the eyes of the other person, past the difference, and remember that that light in my eyes is the same light in their eyes, then I think that allows for a shift in intention, in an openness of heart, in a more global kind of capacity within the brain as we step out of fight or flight and stress response to a more global brain that can help us to navigate challenge, difficulties, and the realities of the work that we do.
Well, that seems like a wonderful place to end. Thank you so much for joining us.
Thank you for the honor.
The honor was all ours, really and truly, because so many things that you said resonate with me and what I hope for the healthcare providers I work for, but also the people that we're trying to help. All right, folks. This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Janet Rodriguez.
Thanks for listening.